COVID-19 Vaccinations from the Patient Perspective, a conversation with patient representative Timmy Nelson on the topic of vaccine access and advocacy. Given your experience as a patient advocate, do you have suggestions that could help improve the availability of the COVID-19 vaccine in rural or minority communities?
One of the things we did here in Pennsylvania, we did some outreach to specifically minority communities. The communities are at most risk and in many cases considered to be least likely to accept the vaccination. So we did some intentional outreach to those communities. And we did some videos. And the videos we did and the webinars that we did, we included professional medical people that looked like the clientele we were talking with. We intentionally reached out for minorities, for females, so that when you're hearing the message from someone that looks like you, that in your mind perhaps has walked in your footsteps at some point in time. So when we did that, what I also share with them is that we need to address the commonly known concerns right up front. Let's take away excuses right up front, address those issues right up front, so it doesn't appear we're hiding anything. And we did that. And the other thing we did it in a conversational tone. As all of us know, in your work environment, you have a unique language to you and your coworkers. The same things in the medical professional. Medical people can talk to each other. With a person who's not medical, you won't understand a word they're saying. So I asked them to make sure that you do this in a conversational tone, so that they feel as though they're just talking to the person next door. They did that and did it very well. In fact, the comments received after this webinar was done was that people commented, they said, I felt like they were talking to me. And I felt like we were just having a conversation. So we addressed the missteps. We did it conversationally, and we allowed time for Q&A. So in the Q&A in the chat room, and also Q&A live, we answered those questions and we addressed the concerns and issues that everyone had. It was about just under 90 minutes when it was all said and done. But it was so informative that even after we recorded it and shared it with other folks, they said it was almost 90 minutes, but I enjoyed every minute of it because it brought something to me, it shared something with me, things that I needed to know. There's one thing to do the vaccination process at a facility, a hospital facility, or a health department. But there are some people that may only live a mile away from that facility. They may be 50 miles away from that facility because they can't get there. For whatever reason, they don't have access. So we've also learned that in some cases, you need to, as we kind of coined it, you need to put a nurse in a van. So what we would do is we'd find pockets of people that may be as small as 30 or 50 people. And we put a couple nurses in a van, give them the vaccine, we schedule a time, send them to that location, and they would vaccinate people. It's a planning process, no question about it. And you've got to work with the community to do that, no problem about that either. But that also builds relationships within the community. So by us doing that, we've established some relationships with the community that we didn't have before, and the ones we did have, we enhanced.
How important is it to get trusted members of the community involved when trying to encourage vaccinations in rural or minority populations?
This is a unique situation for me. I was kind of struggling with this. How do I get access to the community where no one knows me? And believe it or not, I'm in the barber shop talking to my barber and sharing with him this vaccine and how we need to get into communities. And some communities are for whatever reason, more hesitant than others. And I share with him the community he came from was one of the areas we were targeting. And I've known my barber for 18 years now, since I moved to this area. So he and I were talking about it, and he knows me very well. I know him very well. He trusts me. I trust him. And so I said to him, I said, can you help me? He says, yeah, I can. He said, because I believe what you're saying. So he rounded a group of folks up from the community we were focused on. We had a Zoom. We talked about the vaccine process. I answered all the questions I could answer. with my lack of medical knowledge. But what I've learned, I answered the questions I can answer. But I did enough to get them interested. So then I said to them, I said, now, how about we set up a second Zoom? Since you understand what we're trying to do, I'd like to set up a second Zoom, include some medical providers on this Zoom so they can go in more detail and give you more information. I said, these are people that I trust. And we have a conversation now. We develop a relationship, and you somewhat trust me. I trust these people. I'm going to ask you to trust them to hear them out. They agreed. So we set the second Zoom. We talked in more detail. They answered the medical questions that they had and provided that information to them. So then we were able to follow their lead into their community. And they went to their community and did the same thing and said, I met this guy. I met some people that he works with at the hospital. And we think you ought to at least hear what they have to say. And we think you also should get the vaccination. It worked. As in anything we do, relationships always determine results. The better relationship, more than likely, the better the result. And so going forward, when you think about the COVID vaccination process, that's a foundation we built for other health issues, because as we all know, there's other health issues, particularly in the minority community, and the same issues are there, understanding and access. So now you have cases of people that have diabetes. You have cases of people that, like in my case, have end-stage renal disease. You have people that have other issues that they need medical help for. Now they know that they can go to a location. There are people that truly care about what their concerns are. And sometimes that's half of the battle, getting medical help, is really understanding that someone cares about what's going on with me. So we need to view this, in my mind, as an opportunity, or as the expression goes, never waste a good crisis, as an opportunity to use this crisis to do outreach to most immediately get people vaccinated, but then also build relationships, start building that foundation so that for the other issues that minorities and people in rural communities have when it comes to healthcare are also addressed. Because now we can say to these communities that have been out of reach before, out of pocket before, hey, we helped you overcome this vaccination process. We helped you become insulated, if you would, more so from COVID. But now we also need to talk to you about other things that you need in your community. What other healthcare do you need? What other screenings do you need? And if you can find a way to get people together and say, I tell you what, we're going to, the largest meeting group in your area, a rural community, may be your church. So I tell you what, just like you all congregate together on Saturday or Sunday, whatever day you choose to worship, how about we plan a day to come to that meeting place and we bring what you need as far as medical assistance, whether it's screening, whether it's education, we bring that to you, and we help enlighten you on some other things. So that same thought process that we've used to do outreach for COVID and COVID vaccinations, that same outreach needs to be maintained to make sure that people understand that we're here for your other health needs too. If we do that, we're going to find that we're going to have a healthier America, no question about it. And that has to be our focal point. COVID vaccinations have given us an opportunity to do outreach. We have to maintain that outreach.
How has patient and family engagement made a difference in your life and regarding your access to proper medical care?
Patient and family engagement, for me personally, sometimes when things happen, you think you're all on your own. I got to do it myself. But patient and family engagement covers so many areas, but it's specifically on the medical side. Patient and family engagement has to do with having that core group, that support group. And if you think about anything that we accomplish in life, more often than not, if we work it as a team, the results are typically better, because what some person missed, the other person is going to pick up. And we answer questions within ourselves sometimes. And I see that as patient and family engagement. Patient and family engagement meant that even though I thought I could handle my issues all by myself, sometimes you need to share with other folks that care about you, other folks that are focused on your welfare. You need to share with them so that they understand what you're going through, and don't do the opposite like so many people do when they have medical issues. They block people out. we tend to, as people, in many cases, when we have medical issues, medical concerns, COVID, kidney, whatever it may be, we tend to block people out because we kind of go into our shell and we become this hermit almost, and like, I'll handle this myself, or there's nothing you can do for me. Never underestimate the value of dialogue with people that care about you, because just that dialogue itself makes you feel better. Never underestimate the importance of patient and family engagement when it has to do with addressing medical professionals, because the question that is a fog in your mind is crystal clear to someone else. You know, so patient and family engagement in every aspect of medical care is a key to greater success.